Good morning, Dr Rowena Mobbs from Sydney. Lovely to have you this morning, be able to interview you and talk to you about your presentation topic.
Good morning. Thank you so much for having me, Meredith. It's an absolute pleasure, as always.
Yes, always. Rowena, you are going to be talking at the conference around concussion-related disorders in sport, talking about equestrian and giving us an update, which is fabulous. Now, you're going to be speaking on the 10th of July. You are in our first session, which is all about our participants in equestrian sport, and you will be speaking at 6:40 p.m. on the 10th of July. You have a lot of experience in this topic, and we are very, very fortunate to have you. You're a clinical neurologist. You've been practicing in Sydney for 8 years. You actually comes from a strong family interest in this. Your father, I believe, was a neurosurgeon, yes?
Yes, that's correct, yep.
Yes, so it's beautiful that you can follow in his footsteps and contribute, especially to sport, because I believe you are also have a strong sporting representation in Australia in the modern pentathlon in fencing, and you also were in the state teams in hockey and triathlon and cross-country runner.
Yes, if I could have added rugby league to that, I would have. Women didn't do it in those days. So.
Yeah, but also you have ridden a horse, and I believe your mother is very strongly into breeding racehorses, and she's also a trainer. So yeah, it's what a great history that you can support us in this particular topic. And the areas that you have focused on, that I understand, is cognitive neurology, particularly concussion, dementia, migraines, and CTE, which, would you like to say that word, what CTE is?
Isn't that a terrible name? Chronic traumatic encephalopathy. So the subtype of dementia, actually, that umbrella term for a loss of neurons over time.
Yeah. And we need to really understand those effects, and long-term effects of having these types of disorders and injuries. So I suppose my first question for you, Rowena, is there is a lot of talk about concussion, particularly in contact sports. We hear it a lot. Are the effects of concussion in equestrian similar, and do we need to take concussion seriously?
Well, of course, like anything, it's complex. There are similarities and differences. Hasn't it been such a buzz topic of late? And we're all looking for answers as to sport comparison, actually. I think that data will take a decade to really understand here with good investment in funding. But in essence, what we're focusing on in equestrian compared to football as well is concussions, where you have symptoms after a head impact. And you know that represents very often a microscopic injury to the brain. And then you've got subconcussions, which can cause that microscopic injury, but don't cause any symptoms in an individual. So it's a case of how many concussions and subconcussions build up over the years. Yeah,
interesting. So obviously we do need to take it serious, and you're going to tell us more about that at your presentation. So can we only get a concussion, Rowena, just from a head knock?
No, so it can actually be an indirect impact. So the easiest example I find is to talk about whiplash. So many people are familiar with a whiplash from a car accident, let's say, or certainly an equestrian, that would be very easily sustained, where you can have a shaking mechanism in the brain, strain and wear and tear on the brain, torsional effects that can cause a concussion just as easily as a direct impact.
Yeah, right. Yeah, that's important to know. And in equestrian, everyone just wants to get back on the horse or interact with their horse, particularly after a fall, and enjoy the sport that we all love. But can we identify ourselves when it is safe to return to riding and horse interactions?
Well, it is difficult, isn't it? Because we don't have a blood test or a brain image test to sort of say you are safe, you know, your concussion has recovered from that microscopic injury. We just don't have that technology. But I'll be talking more about policies and protocols that we're seeing. We're seeing those extended. And in particular, the UK seem to be leading the way in terms of longer time off after a concussion, which that investment can lead to, you know, better outcome for you riding in the long term. So why wouldn't you think on that? So it's interesting.
Absolutely. Well, going to be very wonderful to hear your insight, because EA has had a concussion management protocol and process in place for a long time. Fantastic. And our members and participants are very proactive in implementing that particular process. But it will be really great for them to hear, more insight around the need to do that in active management and treatment. So, Rowena, thank you so much for your time this morning. You are presenting on the 10th of July at 6:40 p.m. And you're going to talk to us all about concussion-related disorders in sport, and particularly around our equestrian area, and giving us an up-to-date information on that topic. So thank you so much, Rowena, for your time.
Thank you, Meredith. I'm really excited to talk about this wonderful sport, and I look forward to seeing people online for the talk. Thank you.
Thank you, Rowena. Have a lovely day.
Pleasure. You too.